After a baby's born, it's very important to check their cranium and their C1, C2, because sometimes birth is traumatic. And even if you don't realize it, very often the doctor assists in birthing. They pull the baby out, and in pulling the baby out, they can distort C1, C2, and the cranium. Other issues that happen is, let's say a baby after they're born, they just won't stop crying. Nothing you can do stops that baby from crying. They will not stop crying. It's horrible for the baby. There's obviously something wrong, and terrible for the parents. They can't sleep, and they're just a nervous wreck because of it. Sometimes that's described as colicky, a colicky baby. Very often, colic or colicky babies are in pain because of digestive issues. Those digestive issues doesn't allow them to digest properly. It causes pain in the gut because of bloating. They don't want to eat. They just want to cry. So we work on babies' craniums, on their C1, C2, which helps the digestive system. We also work on organs. Very often what will happen, this is just one example, is that for some reason the pyloric valve, which is at the bottom of the stomach, stays shut. And if the pyloric valve stays shut, then the food can no longer pass through into the small intestines, from the stomach into the small intestines. So what will happen is that the baby's hungry because they're not getting food. They keep feeding, and the stomach is just spreading, getting bigger and bigger. And at some point, that baby just projectile vomits. All that pressure is coming from that stomach being so big and squeezing suddenly that they projectile vomit.